Very good. Thank you, Chair. Honorable ministers, distinguished guests, ladies and gentlemen, I'm standing here between you and lunch. So I will spare you a PowerPoint, and I will instead, if it's okay with you, just reflect through the lens of someone who's been working for a global development institution on 5 points that I believe are relevant for the conversations and deliberations you will have over the next 3 days. First of all, also my congratulations, our congratulations from the World Bank for putting this together. The world needs it urgently, and the world needs more of it. Unfortunately, as we have heard already from the previous speakers, we are not really getting ahead of the curve. Despite everything you do, and it's a lot, we have learned a lot, we know a lot, we've collaborated a lot, we've implemented a lot, we still have more people getting infected than in the past, and we have more resistance showing up in our environment. If we want to get ahead of the curve, we got to do something different going forward. I think Dame Sally and Matthew have already alluded to how we can accelerate impact on the ground, because that's what matters at the end. I don't want to repeat many of the things that have been said in the interest of time, but I think several points are really, really important. The first is that this issue is not really a technical issue, it's a people's issue. But the way we are discussing it today and the way the people outside of this room perceive it, it's a technical issue. It's an issue for all of you to deal with and solve. Well, as Dame Sally has correctly pointed out, it's an issue for all of us to get involved with and solve. And for us, I mean, from the World Bank side, we do development. We need to look at everything we do going forward through the lens of, can it be useful for AMR progress? We do the same for climate these days. Everything we do at the World Bank now has a climate lens. Every single team that goes out, it doesn't matter which sector it is, has to ask the question, how can I improve adaptation and resilience in the communities I'm working with, and how can I get a lower footprint out of this investment? We do the same with nutrition. We are asking ourselves every time we go out in agriculture, we have a $20 billion agriculture portfolio globally that we oversee in my department. Every team that goes out now asks the question, it's not just about the calories. How can we improve nutritional outcomes with the same amount of money that we do? And often it doesn't need extra money. It actually doesn't. It's just about asking the right question and integrating into your thinking that lens. And the same needs to be done for AMR. When I get back from this conference, we will have a meeting among our management team, and we will begin to really deliberately and systematically think through how we can get co-benefits from every investment we make, and how we can, whatever we do, make it finance in a way that actually helps the cause that we're serving here. I think if we all do that mentally and practically with our investments, it'll make a huge difference. We've seen that within just 2 years, and I'm just giving another example in the World Bank, about 2 to 3 years ago, our climate co-benefits in our portfolio in agriculture were less than 10% because we didn't really think about it. Last year, which our year ends in the end of June, last year we landed the portfolio at 46% co-benefits. That means out of the $5 billion that we're working through your governments to implement, 46% of them have adaptation co-benefits and mitigation co-benefits. If we can achieve the same with AMR, we can help accelerate implementation. That's my first point. And we need to go out of this room and turn the tripart into a 10-partite and bring everyone who matters into this conversation going forward. And who matters, Dame Sally has made it explicitly clear, and I don't want to repeat it, but what I will repeat is the role of the private sector. No matter how you look at it, solving the antimicrobial resistance problem globally cannot be just financed through the public taxpayers' money. It simply won't be enough. It will not be enough. And it should not be funded through taxpayers' money going forward on itself. The private sector has to have an interest in this. And like as was pointed out earlier, they do have an interest in this. The kinds of things that we're discussing today with private sector, whether it's HBSC, whether it's private banks, whether it's reinsurance companies, Zurich, Munich Re companies, whether it's private companies in the food system, They are all interested to do the kinds of things that 5 years ago you would have thought were completely impossible. So we are learning, and everybody needs to learn how to engage. We have not landed, and correct me if I'm wrong, we have not landed globally yet the operational model that translates private investment into the outcomes that we all want. We are getting closer. There are now increasingly funds being created that do a piece of it, but we haven't landed it yet. But I'm very optimistic that in the next few years, we will find ourselves in an environment where major investors with billions and billions of dollars will find a way to invest in the kind of work that you do on the ground in the countries that we work with. I think that's a piece of good news. But for that to happen, everyone has to be really inclusive. Everybody has to learn the language. One of you in the earlier speeches mentioned how difficult I think you also, Sally, you mentioned that it was difficult to speak each other's language. It's even more difficult with the private sector to speak each other's language. So there is a lot of, it takes some time to actually get to the point where you can have your sweet spot, where you can have the one thing that everybody wants, and then start funding it. But when you're there, the real money flows. Now, for that conversation to have, you have to talk economics, and you have to talk financial flows. From a purely, and finance and economics are two very different things. From an economic perspective, solving the antimicrobial resistance challenge that you're all trying to do is an absolute no-brainer. Because if we don't solve it, we will have a crisis between now and 2050, which will be far bigger than the financial crisis we experienced 10 years ago. I don't want to rattle down a lot of the numbers. We have a report on this, and you can look it up on the web. But the current estimates, business as usual, will lead us to 1 to 3% of GDP reduction, which will have massive impact on the SDG outcomes. It will increase the number of poor people. It will have all sorts of repercussions across the board. And it will hurt the economy to the tune of somewhere between $6 to $8 trillion going forward. So this is very, very big. You would say it's a no-brainer. The question, what would it cost to avoid that? There are several estimates. There was the O'Neill report, which I think came out about $4 billion per year ago, for the next few years. We come out a little higher because I think we drive it maybe a little bit deeper into the development agenda and the co-benefits agenda. So we would look at maybe $6 to $8 billion a year to actually avoid a several trillion dollar loss. I mean, you don't have to be an economist, right, to say that would be a good investment. So it's not the numbers that matter. The thing is, how do we get the $6 to $8 billion invested on the ground? I mentioned the private sector, but let's also not forget the public sector. And I want to talk a little bit about something that we have been beginning to discuss in Europe particularly, but also in other parts of the world, and that is how you can more strategically use the amount of money that governments give to their farmers, usually called subsidies, right? You heard about that? Anybody has any idea in the room? Some people will know what the total amount of agricultural subsidies is at the moment globally per year. Would you have an idea? Take a good guess. I bet it's higher than what you guess. It is actually $600 billion per year. $600 billion per year. That far outweighs any ODA, anything else that Green Climate Fund, what have you, anything else you can think of. This is your money, this is taxpayers' money that is being given to farmers for certain purposes, mostly to increase their income, help with their security, etc., etc. But it has also become clear that this money in many parts of the world does not help with the public good outcomes that we want from that sector. It does not help with reducing the footprint. It does not help with improving nutritional outcomes for the population. And it does not help with issues like AMR at this point, with some notable exceptions. Now in Europe, and I say this very clearly, in Europe there has been a significant change in the last 20 years. An increasing amount of money that the Common Agricultural Policy provides for its farmers, 60 billion euros, by the way, per year roughly, increasing percentage of that amount of money actually leads to better public good outcomes. So it actually, in my book, is not a subsidy anymore, it's an investment in a public good outcome. The carbon footprint of European agriculture, for instance, has been reduced by 17% in the last 20 years as a result of the way the funding is transferred to farmers, incentivizing less fertilizer use rather than more fertilizer use, thereby reducing the footprint without compromising on yield at all, improving technology, etc. So it's a very specific, deliberate attempt to get a public good outcome, while at the same time giving money to the farmers, which is what you want as a government. You want to support your farmers. So I'm not arguing against providing funding to the farmers. It's a different argument from saying reduce your subsidies. Increasingly, we believe that this amount of money, even the 500 billion per year, is actually necessary, but it needs to be spent in a more intelligent way. And still give it to your farmers so they have higher incomes, more security, et cetera, et cetera. That kind of conversation nowadays gets a lot of traction. And I would recommend to you in the room who deal with the veterinary services and directly related to agriculture subsidies often, to make the case for why it makes sense to use some of that funding, give it to farmers so that you actually get a public goods return. What's wrong with supporting peak production that has just a little bit more space so that you reduce your antibiotic use needs? We will talk about animal husbandry practices. Why not support those that get you a better AMR outcome? Politically perfectly feasible. You give it to the same farmers, no problem, and you have an added benefit, co-benefit. So this is the kind of conversation that's happening at this point. If only a fraction of that amount of money globally could be mobilized to support your work and multiply what you are doing and accelerate what you are doing, it would make a huge difference. Fourthly, I think it was also mentioned before, we still have a major data problem. You cannot really design policy properly unless you know what's going on outside. And unfortunately, we really don't know a lot of things yet. Fortunately, Bill and Melinda Gates Foundation and others have recognized this issue, and we've just entered into an agreement program with them, $500 million altogether, to improve agricultural data and statistics around the world. And this is maybe just a subset of that. But we should look into this, because there is so much going on in the environment today in many countries that we have really no idea about. I mean, I read an article every day of something, antibiotic dumping discovered somewhere, but there's no real, I mean, I know there is a lot of progress. I'm not trying to be critical. I read the reports. I know many countries now are in a better situation of reporting their data regarding AMR than they were 5 years ago. But you still don't, it's still not nearly close enough where we are. How am I doing on my lunch? Doing okay. Okay, so let me wrap it up so we have a couple of minutes for our conversation. Going forward, you need more champions that speak the people's language, not the technical language out there. We only saw progress in climate when people began to own it, because then that's when they put pressure on their government. And the UK was a very good example. It's the people who put the pressure on the government to put the money where it needs to go. If that process doesn't happen, it's really, really hard to convince a Minister of Finance to say, yeah, this is one of my top 5 priorities. Very hard to do. You need to tell a people story. And it's very good to see in the program that I think it's the day after tomorrow, you have communication specialists in the room, special session on that. How do we turn this into a story that touches the heart, that touches the mind, not just the rational part, but where people really say, yeah, you know, this is about my future, this is about my children, this is about my grandchildren. That's what climate change communicators effectively did in the past few years. It is now, when you ask the public now about climate change, most people, except for a few deniers, will say, yeah, it's a big deal, and we really need to do something. You ask people on the street about AMR, they will look at you, AMR? What is that, right? And even if they actually heard the term before and understand the term itself, they don't know what it means. So we need to do a lot more. And this is not us doing it. This needs to be done by professionals who really are out there doing precisely that kind of branding and championing and advocacy going forward. Let's practice One Health going forward. All of you have said it. Let's do more of it, because it's not really, in many parts, done as effectively as it could. And for me, One Health is not just agriculture, medicine, and the environment. There are many, this is a whole of government is One Health. Education, infrastructure, water and sanitation, That's really One Health in my view, because if you don't pull these pieces together, it's not going to go anywhere. So sorry for being a bit short, but I thought you would forgive me if I spare you the PowerPoints. So, and thank you for your attention.